The 4Ts model is a single employer model for providing whole of healthcare in small rural communities. The 4Ts are 4 small rural communities in central west New South Wales. Those towns are Tottenham, Tullamore, Trundle and Trangie, of approximately less than 1,500 people each. All of these communities have experienced private GP, primary care market failure at different points in time over the last number of years. What that meant was that the community didn't have access to a GP for their primary care.
So it got to a point where we were losing our doctors, our full-time doctors. They were all at the retiring stage. So what we had to do was get together and try and work out the best solution on keeping some sort of medical service in the town. So we got together with the other Ts in the end and approached the area health service and sort of said, well, this is our dilemma. We've got no doctors coming in. How can we work together to make this happen?
And they're all basically the same size communities. And the idea of putting these 4 communities together is to attract staff and a doctor to be able to service these 4Ts. Instead of having to have a doctor for each one of these communities, we can be able to have them as a collective.
The 4Ts is an ecosystem of one practice across multiple communities, where our staff, our key clinicians, our administrative staff, are able to work together to meet the community's need.
What that means for these communities is access to a primary care clinic co-located with their local multi-purpose health service. The primary care clinics operate just like a GP practice with a GP, a primary care nurse, an administration staff member and also a medical centre manager. There's telehealth support where the doctor might not be available on site.
I like it that I do get a little bit of work within the hospital as well and in the emergency department, and I get to have the resources of the hospital, which is really helpful for a GP. So we get those resources, we can admit our patients if we need to. It's a very, very good place to work in that regard too.
Well, I think it's the only way we're going to have medical coverage in these places is to have a collaborative model between close communities where they can share the medical workforce between them to provide at least a reasonable service for all of them.
So having the doctors locked in the 4 communities and that continuity of care, I think we've brought the community on board, and knowing that we are working towards trying to have an established GP practices within each town and them being able to access that healthcare when needed.
It harks back to the golden age of medicine in a lot of ways, where you're looking after people from the cradle to the grave, and you're feeling a welcome part and an important part of the community by providing those services.